Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this broadcast series, we talk once a week about all types of globally relevant infectious diseases. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor. Good afternoon and good evening to everyone watching us wherever you guys may be.
I'm very happy to see that you're with us again today. And Global Health Press exists for 13 years now. And until today, we have no ads connected to this broadcast. So this is important to us. We're independent, Melvin, right?
Yep.
Melvin, what's the COVID update?
So this is from the WHO COVID situation report, where we get our information every week. And you can see here that the number of weekly cases reported last week was similar to the number of cases reported the previous week. And then if you look at the deaths as well, you will notice that the number of reported deaths during the previous week was similar to the week of reporting. So the message here is that the number of cases and deaths have basically plateaued.
Yeah, that's interesting as there is summertime. Everybody is meeting outdoor places and with many other people from many countries. I was in Salzburg last week, very great vacation. I visited the salt mines, and was a group of 60 people from all around the globe. Nobody was wearing a mask. I was the only one with my wife wearing a mask. So let's see what happens next week after the Salzburg event, right?
Yes, and I can tell you, I was also in Hamburg last week, and then over the weekend I was in Milan. And yes, I think people have forgotten about COVID now.
Yeah, let's see if there is a Melvin effect traveling around in Europe and there is an increase next week, would be my prediction. What we're going to do today is we will answer your questions. Thank you for sending us your questions. This is really great. This is what we're here for. We want to address what you want to know. And these are the questions, and we start with the first one. Why should we get booster doses, and what happens if I refuse a booster? Well, this is how vaccination works. You inject the vaccine into the muscle. This is the right upper arm of a person who got the vaccine, and that's the red dots here. That's the vaccine antigen. There is an antigen phagocytosing cell that picks up the antigen and brings it to the local lymph nodes. So in the case of your upper arm, left upper arm, I'm writing with my right hand, it would be the regional lymph nodes here under my arm. And there are naive B cells and T cells. They pick up the antigen, and what happens here is shown here. The antigen is presented to these immune cells, and they react as a result of this trigger. And you see here, this is the B cell, this is the T cell. They interact, and that results in the production of memory cells. Once you've had an infection, once you've had a vaccine, the memory cells make sure that there is a rapid response later on. The other cell that is produced is a plasma cells, and plasma cells produce antibodies against the antigen. And the antibodies are very important for protection, as we will hear later on. Only with polysaccharide vaccines, there is only a B cell response. So in 2022, nobody should receive a pure polysaccharide anymore, in my view. But that's my very personal view. Melvin, you can comment later on, but polysaccharides are really outdated. So you have no T cell response with a pure polysaccharide. You only get short-lived plasma cells for 3 to 5 years, and then your immunity is gone. You no longer can detect antibodies. We already had in our first session discussed the difference between immunity and protection. This is immunity. You get antibodies. And this is shown here. After a first shot, you get nice antibodies in this line here, and then they start to decline. And that's why you get a second shot, and then you get another even better response. This is called the primary series, 2 shots. And with COVID, this is 3 weeks apart, 4 weeks apart, depending on the vaccine that you receive. It doesn't matter that much. It should be at least, I guess, 2 weeks apart with most inactivated vaccines. And then after a while, you get a booster shot. And then you get really long-term protection. The long-term protection with COVID, we will discuss later on, maybe roughly 6 months, maybe even less, depending on your age, underlying diseases, and so on and so forth. The later the booster, and that is what Melvin will show you in a later slide, the later the booster, the higher and the longer the long-term protection. But with COVID, antibodies are only part of the story. We know very well, even in the absence of antibodies, you can be protected, at least partially, and that may be from T-cell protection, and we don't discuss this here today. And this is now the protection data from the original Comirnaty trial from the Pfizer mRNA vaccine, Pfizer BioNTech vaccine. And you see here, this is the vaccinated group. This is those who received a placebo, no effect. They come down with COVID all the time in the placebo group, whereas those who received the real vaccine are protected as of day, 10, 9, 11, whatever. That's where protection starts. And efficacy of the vaccine is 95% in this study. And if you look now over time, and that are follow-up studies that show effectiveness, what happens in real life, no longer a double-blind randomized study, you see here for those who are 60 years and older, any infection with the Delta variant, 37 to 66 days, 88% effectiveness. If you go to 126 days, it goes down to 50%. If you're older, it goes from 79% to 43%. So with age, immunity and protection go down. If you look for severe disease and a mixture of variants, it goes from 89% to 88% after 156 days. And in people 65 and above, it goes from 88% down to 83%, which I think for severe disease is really what we aim at, right? Very clearly, COVID vaccines don't eliminate the organism. They control the disease, and control means hospitals don't get overcrowded and you usually survive. That is my main message. So you should get booster doses and you do get some protection. It's not optimal, but you do get some protection and you can control disease. Melvin, any questions on booster shots? Any comments?
No, I think it's clear. We have been telling people that it's not just the antibodies, right? Because if you listen to mainstream media or even people in social media, people always focus on the waning antibodies. And I think that's the wrong message.
Yeah. So your question is, what is the period when you should get the booster dose? How long after the last dose should you get your booster?
Yes. So for this question, our answer is on the next slide. Basically, for most people, at least 5 months after the final dose in the primary series. So the primary series, of course, is the first 2 vaccination doses that you get. And then for people who are moderately or severely immunocompromised, at least 3 months after the final dose in the primary series. And in the next slide, we will see a very nice illustration from the New York Times. We see the effectiveness against symptomatic infection. So on the first graph, you see protection starts to wane around 14 or 15 weeks, and that corresponds to 3.5 to 4.5 months. And again, this is for infection. For hospitalization on the third graph, protection is much longer, around 20 weeks, and that corresponds to 5 months. So some people might ask, why not after 1 month, right? But the spacing between doses is also important for maximum benefit. Waiting for at least 5 months is a prudent course to take, and having a booster dose too soon after the last one or after an infection is not dangerous per se, but may not really add much to your immune response, as our immune system might not have enough time to process the previous infection or vaccination. And that's the reason why dosing is also important.
Yeah, very important point. And again, I guess the wording that people don't understand, or the terms that they don't understand, is what do you want to achieve with your vaccine? We cannot achieve elimination of the organism because natural immunity doesn't achieve this. You can get COVID after you had COVID. So the only thing you can do with a vaccine is control the burden of disease, and here the burden of hospitalization particularly. Very
Yeah.
nice. Happy you found that one in the New York Times. But people who got booster shots still contract COVID. The answer is yes. And again, the concept is elimination is not possible with current vaccines, and it is not possible if you had your COVID disease. You only can control the disease, and you can make sure that the severity is reduced. And that again is a statistical value. If you are treated with cortisone, if you receive high doses of cortisone, if you get chemotherapy, if you have certain underlying diseases, you may get very severe COVID, even if you had your vaccine. It is all a question of statistics. I saw in the social media people who said, I got 4 doses and I came down with COVID and I was not happy about it. I was really sick. The answer is that no vaccine can prevent at this point. We are not better right now. We don't know how we should design a vaccine or make a vaccine so that the COVID organism, that the virus is eliminated from humanity. We cannot do that at this point. And I think that was my idea. Anything to add, Melvin?
No, I think it's pretty clear that you've mentioned already that people who've had COVID in the past can still get COVID, especially with the newer variants. And it's same thing with vaccination. And so I think it's
Yes.
a good segue to the fourth question, which is, can booster shots address the new variants? How about monkeypox? So firstly, with the new variants, we have to say, right, that especially with the newer Omicron variants, in terms of infection, the vaccines are not as good as fighting the previous versions of SARS-CoV-2. But COVID vaccine boosters can still improve protection, especially with severe consequences of COVID, including the severe consequences of the new variants. And I think it's also good to tell people that one of the reasons why we recommend getting boosters is that boosters actually broadens the protection that you get from um, the vaccine. And with regards to monkeypox, it's not the same as SARS-CoV-2, the virus causing COVID-19, and they're not even closely related. SARS-CoV-2 is an RNA virus. It's a beta coronavirus genus from the Coronaviridae family. And this family includes SARS, which was identified in 2002, and MERS, which was identified in 2012. And monkeypox is a DNA virus. It's an orthopox virus genus from the Poxviridae family. And this family includes the vaccinia virus, cowpox virus, and the variola virus that caused smallpox. And on the next slide, you will see the cartoon of the 2 different viruses. So why am I showing this? This is just to show that these 2 viruses are different and look different, and our immune system is very specific. It needs to be able to differentiate healthy from unhealthy cells and tissues to work effectively, right? And so for viruses that are different but very similar, for example, smallpox and monkeypox, there is a concept called cross protection. But for COVID and monkeypox, there is no cross protection. These 2 are very different viruses.
Very good. And if you have more questions to monkeypox, go to our monkeypox special we had a couple of weeks ago. So all the information, all you want to know is on that edition. Great. So 2 different viruses, and they have nothing in common to even assume in any way or hypothetically assume that there might be some cross protection. There is nothing. They are not linked at all.
Yep.
Does a booster shot cause allergy? And the question is, if you mean food allergy or asthma, the answer is no. You can get an allergy, an allergic shock after vaccination. This is quite rare. With other vaccines, it was shown to be in the magnitude of 1 per 500,000 vaccinations. And the vaccinator always has to be in a position to treat allergic shocks on the spot if it at all happens. And this is why you need to stay with a vaccinator for, depending on the country, 15 to 30 minutes in the same room to make sure that there is no allergic shock. With regard to allergies, asthma, food allergy, whatever, skin allergies, there is even nice data to show that there is less allergies if you are well vaccinated. This is from the past where people were questioning pertussis vaccination, measles vaccination. This is old data. And I remember very well from 20, 30 years ago when this was highly discussed. And again, there is no indication that vaccines call these regular, let me call them regular type allergies. Other side effects are roughly the same. We decide, and that may be another edition of Global Healthcast, what are side effects. We distinguish between reactogenicity, which means fever, not feeling well, headache, local reactions. That is reactogenicity. That is roughly the same. And then we have severe adverse events. And again, there is no indication that this increases with any booster dose. That is the short answer to the question. And again, we should have a special on this in a later Global Healthcast. Melvin, should a person who has had COVID still get booster shots? What's your answer?
Well, short answer is yes. And I think I want to show this illustration from Science Magazine. This is from the study of Professor Shane Crotty and colleagues. And basically, it shows us that immunity from SARS-CoV-2 infection and immunity from vaccination are both good, but hybrid immunity is different. And the reason why I'm saying this is there is a study from Yung Kai-yu and colleagues published in Science Reports showing that people who were vaccinated against SARS-CoV-2 had antibody levels 17 times higher against spike protein compared with people who had a natural infection. And also another study published in Science Translational Medicine show that antibodies from the vaccine targeted more areas of the spike protein than those formed against infection. So I guess here we have to say again to highlight that our immunity to pathogens is not all about antibodies, right? We've mentioned it several times that an effective T cell response is key in clearing SARS-CoV-2 from the body and preventing severe disease. But the message of this image, this photo really is that hybrid immunity is much stronger. And when we say hybrid immunity, it means you have immunity from infection and the vaccine. And we are not advocating getting the infection, but what we are trying to say is that if you have been vaccinated first, your immune system is much more ready to fight the infection, and the immune system becomes even better in fighting COVID the next time you are exposed to it. So we do not advocate getting immunity only from infection because immunity from infection is not consistent. It depends on the variant that infected you, and you risk not only getting severe COVID, but also long COVID if you get the infection. So yeah, that is the message of this image.
And I guess I have an answer that is on the protection side versus Melvin's answer, which was on the immunity side. So here you see long-term care center employees, those who take care of people in centers who may be sick, and these employees have a high infectious pressure. They are frequently exposed to COVID. This is why I chose this group. And here you see what happens if they were not vaccinated. This is how they were free of disease over time. So they get disease all the time, right? And finally, here 15% have had it. As compared to those in the black line, complete primary vaccination series. This is the black line, right? So they were nicely protected, and reinfection really is coming only very late. And if you had partial CPVS, then you were less protected. So the more doses you got, the better. That is the short story. Melvin, any comments on that one?
No, I think it's pretty clear that really it's better to be vaccinated, fully vaccinated, than not be vaccinated. But I guess the other thing I can mention is that this partial CPVS is not very clear, because if you say complete CPVS is complete vaccination, right? Then you should say that the other one is not complete, because it's just
it
not
should
clear.
not be CPVS, but PPVS, right? Partial
Exactly.
primary vaccination series, not complete partial. This is funny. That brings us back to our last edition, right, on language, medical language. But anyway, we cannot change language. And this is again to remind you that the booster effect is really after 5, 6 months, whatever you choose with your physician, and that goes down as well. It is this is more a hypothetical curve, like this IgG for hepatitis B or hepatitis A that persists for a very long time, and with COVID it declines more rapidly, going along with protection rates. So main messages from today with COVID-19 update: cases and deaths plateau, nothing much new. And then the message is: first, get your booster dose, get your booster dose, please get your booster dose, and write us any questions you may have at the address shown below, ghc@globalhealthpress.org. And I guess the cartoon of the day then would come later on, but the question that you may ask is, if you get all your booster doses, how many can I get? We showed you that in our last cartoon, but see here, a man in Germany gets 90 COVID-19 shots to sell forged vaccination cards. And this is the detailed story here. The man was an elderly person and he survived, apparently. He is doing well, but he got 90 shots. So it's not that dangerous, right? You don't die from COVID.
A lot of people have been asking me, is it safe to get the booster dose? I always send this link to them. I'm not saying that they should get 90 booster doses, but I'm just saying that even if you get 90 COVID doses, you'll be fine. Yeah, so that's what I was trying to say.
Yeah. And look, it doesn't help you much. If your antibody production capacity is at the highest level, getting a next dose next week, it cannot get more, right? If you drive with your car at 200 kilometers per hour over the Autobahn, you cannot increase it by pressing your foot even more down, right? You won't get more protection out of it. So it's all what you're, whatever you have is what you have, and an additional dose won't do much difference if you give it too early.
Exactly.
Well, that brings us then, where is my slide? That brings us to the next slide. This shows that you can get more than one dose, right? And this is not even 90, right? Against all the different antigens. And there is one other cartoon or one other joke we wanted to tell you is, the question is, should I get all my children vaccinated? And the answer is, only those you want to keep. I guess that is the end of our session today. This was our Global Healthcast on August 2, 2022. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you, everyone, for listening, for watching, and send us your questions. We are always happy to answer them.